It is a shocking finding. Some Ontario doctors have been billing the province for more than 24 hours in a day, or even claiming to work 365 days in a year. Let's bring in Tina Yazdani with the numbers now. And Tina, this is all part of an auditor's report that finds the Ford government isn't properly overseeing healthcare dollars.
Yes, Cynthia, and as a result, the Ford government is losing money that it could be using to, for example, add more doctors to the healthcare system. That's according to the Auditor General. And those are findings from just one of 6 reports she released today, painting a scathing picture of how taxpayer dollars are being spent.
It is outrageous that taxpayers are being asked to foot the bill for what are partisan ads.
But Ontario taxpayers are paying more than ever for government ads. The Conservatives spent a record $112 million taxpayer dollars on campaigns in the last fiscal year, more than any other government in the province's history. 38% of their campaigns, totaling $43 million, are considered partisan, according to the Auditor General. Why should taxpayers be on the hook for promoting the Premier and his party?
It's important both before or after an election cycle for the public to be informed with nonpartisan government advertising. That is what we're doing. That is what we're committed to. And these are government ads that are informational. They're informational and educational.
What a waste of people's money on ads when they could have been spending that money on, connecting people with a family doctor.
In fact, a second AG report found not enough people are being connected to family doctors. Only 11% of the more than 2 million Ontarians without one are currently registered with the government's Healthcare Connect portal. Is that an acceptable number to you?
Healthcare Connect is only one tool to get yourself connected to primary care.
With the health minister out sick today, her parliamentary assistant attempted to brush off the findings of the auditor's numerous healthcare reports. A third audit into physician billing found potentially inappropriate payments. For example, doctors who billed for more than 24 hours of service in a single day or provided services to an unusually high number of patients, like 100 a day. An analysis found 3 to 5% of claims had anomalies, translating to up to $600 million in potentially inappropriate payments annually.
It just was so glaring to me.
It is an exceptional situation. The physician bills for several different procedures on that one patient and sends in several different bills. Not one bill for one patient, but rather several different bills for the one patient. For the procedures which the patient received.
But is that how it should be? Is that doesn't that end up costing taxpayers more money?
I believe that physicians deserve to be paid for the treatments that they deliver. The ministry later clarified that it is, in fact, strengthening billing oversight and accepting the AG's recommendations. One of those recommendations is to hire more post-payment audit staff. Currently, it is just a team of 8 reviewing these anomalies. Cynthia?
Okay, Tina, now there were also unusual findings about the government's burning hundreds of millions of dollars in personal protective equipment.
Yeah, the auditor found that the government is still purchasing the same amount of PPE that it was during the height of the pandemic. Of course, demand is down significantly, and a lot of these items are now expiring. So the province has taken to incinerating hundreds of millions of dollars worth of PPE. So far, 780 units have been burned. And when we asked the government why it is still procuring so much, they simply said they're actually trying to support the local businesses and the contracts that they have with some of these businesses. The auditor also found that over the next 5 to 10 years, another $100 million of taxpayer dollars will be wasted on expired PPE. Cynthia.
Tina Yazdani at Queen's Park. Thank you.